Yesterday, you should have received an agenda, but just to recap, we are going to have an introduction to the whole of the Volunteering for Health initiative from my colleague Jules Alderson from the ICB, and then I'll tell you a little bit about the aspect that we're particularly talking about today and addressing today about connecting with the voluntary sector. And then Kata will be talking about the new innovation fund and how we see that working. And at the end, after that, there'll be a chance for you to ask questions. So if things occur to you, you can either pop them in the chat or wait until after Kata's explained about the innovation fund, and then ask any questions that you may have if you still have got queries. After that, my colleagues Laura Holland and Hannah Scuffham will be telling you a little bit about the Get Involved Skills website. It's going to be a sneak preview because it's not fully up and running yet, but they will give you an introduction to it. So that'll be in the last of 10 minutes or so. But we will finish by 3 o'clock. So once again, thanks for coming, and hand over to Jules to tell us about Volunteering for Health.
Hello. I think you've got some slides for me, but before I start, I can see in the chat that somebody else is having problems with the echoey doubling up sound. Can everybody hear me okay? Yeah, okay.
Yeah.
Lovely. All right, thank you. So I'm Jules. I am the volunteering programme manager at Norfolk and Waveney ICB, and my role within Volunteering for Health is as the programme manager for the project. So I'm just going to start the session today giving you all a bit of background about the programme, and then I'll be handing over to, as Nikki said, other colleagues to actually go into more of the detail about all of the different elements. So if we have the next slide, please. So Volunteering for Health was a really exciting opportunity because it's not very often that there are system-wide opportunities for volunteer investment, particularly in infrastructure. And it came about because in large part of the NHS Volunteering Task Force report, which took place mostly in 2022. And that programme looked at volunteer involvement, particularly within the NHS, following the huge surge of interest in volunteering during the COVID-19 pandemic. And this report recognised that there were really good areas of volunteer involvement within the NHS, but actually it wasn't something that could be seen kind of equally across the board. So one of the ideas of this, or one of the kind of initiatives for this programme, was to try and address that, particularly at a system level. So as you can see on the slide there, part of the aim of the programme is to speed up change by helping to break down barriers to volunteering, testing new volunteering infrastructure models, and developing guidance and best practice for all systems. And then with the ultimate aim that the learning that's drawn from the activities which take place during the course of the programme, which is a 3-year programme, that we'll be able to make the case for investment in volunteering and better understand the impact that volunteers can have. And I should also point out here that there's always been a bit of confusion about what Volunteering for Health actually means. Does it mean volunteers for the NHS? And that's absolutely not how we've interpreted it, but we're interpreting as a much broader, people's health and well-being. So although there's lots of mention of the NHS in this slide, it's not specific to the NHS, and it will hopefully all become a bit clearer in the following slides. So the next slide, please. So for our partnership, we gathered a big group of stakeholders together, and we were really lucky in a way because we'd already had a lot of work done within our area in our vision for volunteering for Norfolk, which had been led by Voluntary Norfolk. So we already knew quite a lot about the landscape of volunteering, some of the opportunities, but also some of the gaps. So we were able to build from that to put forward our proposal. And the information that we took from that allowed us to understand that one of the big gaps for us was in our diversity of our volunteers. So we've got a lot of people volunteering, but in many organisations, they're not representative of our broader communities. We also know that we've got absolutely brilliant pockets of volunteering within our health settings, but that's not the same everywhere. So, for example, the Norfolk and Norwich have got a really well-funded, well-resourced volunteering team, which means that they can link in with lots of voluntary sector organisations and have lots of development. But other organisations, there is only kind of one person covering 2 counties, and actually volunteering isn't really well understood within those organisations and within those settings. So we knew that we had a lot to do in that area. And we also recognise that the support and training opportunities for volunteers and the people that manage them is not always equal either. So what we wanted to do was include within our projects elements that would make it easier for volunteers to access more training and support if they need it, but also equally recognise that it's not very easy always managing volunteers. So giving more support and opportunities for development for the people that manage them. So we pulled together our proposal, and if we move to the next slide, we were very pleased to find out that we were one of 15 partnerships to be successful. And on this slide here, which it looks very small, I don't know if you can see it, but we can circulate this later, and I know it's available on the web page, is a breakdown really of the programme. So the 4 key pillars of work that we'll be doing. And as Nikki said, we'll be going through some of these elements in more detail very shortly. But firstly, there's the element around the support for volunteers and those that manage them, so that we can ensure that volunteers, wherever they might be in Norfolk and Waveney, have the best experience they can. We know that people are finding it more difficult to volunteer these days because of so many different reasons. So it's really important that they have a good volunteering experience when they do choose to give their time. We want to make it easier for people to volunteer. We know that some of our processes are quite difficult to navigate, to understand. They're quite paperwork heavy in some places, and we're really keen to explore how we can make it easier for people to get through those processes, or in fact, can we change some of the processes to make it easier for people to volunteer? Perhaps the most exciting element is the Innovation Fund, where we'll be pioneering new volunteering roles and approaches. So seeing how we can adapt what we already have or try something new, with a particular focus on involving cohorts within our Core 20 Plus communities who might not volunteer already or be less likely to volunteer, and test and learn from different approaches to see what could work so that we can make volunteering feel like it is for everybody. And then finally, through all of that work, will be supported to evaluate it by the Institute of Volunteering Research, so that we can come away from it being able to demonstrate, we hope, why volunteering is so important, the different benefits it can have, the different benefits on health outcomes and experience it can have for the people that take part in it, as well as the people that they support, so that we're working towards a space where there's sustainable investment and recognition of volunteering. Thank you. Those are my slides. So I think it's over to you, Nikki and team, for the meaty details.
Great. Thank you very much, Jules. I hope people found that sort of context setting useful. And just to add to that, Jules made reference to the Norfolk Vision for Volunteering, and this is an initiative that's been going on in the background now for a couple of years, trying to look at the particular challenges to volunteering in Norfolk and how we can help organisations overcome them. And so this project sits sort of alongside that bigger piece of work, which is working at a sort of strategic level, and also with many VCSEs at a sort of more operational level, looking at what good volunteer management practice looks like, and how we can make the volunteering sector very robust. So they're working together, they're aligned, and it means that we're trying to build the story that volunteering is so crucial to the wider community, and also to the sort of health and care settings, that volunteers bring such a lot from their lived experience, their range of skills, and that they similarly benefit from it. There's a lot of research out there proving that volunteering is really beneficial for people. It helps their well-being, their mental health, their sense of connectedness, their social contacts, their sense of purpose. So this really is about looking at those dual sets of benefits and seeing how much we can encourage and support them. So we're here today to look particularly at the strand of this project that's about engaging with VCSE partners to see how volunteering can be more attractive and accessible to people who have experienced health inequalities. And from the research that exists about those health inequalities in Norfolk, we have selected to prioritise working with adults with learning disabilities, neurodiversity or autism, and looked after children or children leaving care. So there were other fields we could have chosen from. There are many areas of health inequalities, but those are the ones that we have selected to focus on, certainly for the first year, possibly going forward for the next year as well. But also looking across the whole of Norfolk. We know that the coastal regions, the rural regions, parts of our urban areas, there are higher areas of inequality. So we're looking to see how we can also look to engage with groups that are based broadly across Norfolk and indeed Waveney. This is now lines with the ICB footprint, so it is Norfolk and Waveney. So yeah, there are three strands to the project. There's one which, as I say, mentioning about working with VCSEs. There's another that's specifically looking at how we encourage volunteering within health and care settings, and the third is about looking at the skills improvement and the opportunities for training and development, and that is through an extension to our website, which is going to be called Get Involved Skills. So we're going to have a brief introduction to that at the end. I think the main thing I wanted just to sort of flag up before Kata talks in detail about the new Innovation Fund is that this really is a project about us learning what works, learning, working in partnership with you, organisations that are sitting here today, who have got the expertise on the ground about working with these identified groups, and who can work alongside us with us to produce projects where we can really trial new ways of encouraging those groups to volunteer and to get those benefits of volunteering. So the project is evolving all the time. It is a 3-year project. In fact, the first year has been spent developing it and understanding what it is that the funders are really interested in, and talking with the other 14 partnerships around the country who are all doing vaguely similar stuff to us, but in different ways based on their local needs. And actually quite a big part of this project is about not working in isolation. It's about looking at how we can all learn from each other, which makes it very exciting, but it does also mean that things might change. So for instance, you will be hearing all about the Innovation Fund, and there's a certain flexibility in that. And even in terms of when the application dates may be, we haven't actually set that down yet, because we want to learn how long it takes to co-produce projects. How long does it take for these to be delivered? So if you see changes as we go down the line, don't be too surprised, because because we're going to be learning alongside everybody else. I think that's all from me. I'm going to hand over to Kata, who just joined us a couple of weeks ago as our new volunteering innovation manager. So I'm really chucking her in the deep end to ask her to present on the new fund. But she's really got her teeth into this project and is keen to start talking to all of you about it.
Thanks, Nikki. Hi, yeah. So my role is really to help organisations through the process of applying for support and funding for these new projects, these innovative projects that will support people from the target groups that Nikki was just talking about, and to support those people into volunteering. So as well as that, I'll be working with you and other organisations to help co-produce your plan, because this isn't just about submitting something and then moving forward with it. It's really about co-producing and how we can all work together for kind of more cohesive networks. To make sure that plan is really robust, to walk with you through the awards panel, and then to connect you to the support that the partnerships will offer you if the plan's successful. So as Nikki said, it's the very beginning of delivery. We're going to be doing lots of learning and listening. Very beginning for me, because I'm only a few weeks in. But luckily, there's been so much work that's happened over the past year that I've been able to learn from. And the idea is that, you know, with us listening, we can make that a much more effective process, and then we can learn from your individual projects and feed that back into the national picture. We all know that volunteering can bring health and social benefits. We know that the rates of volunteering are declining in Norfolk, and we're interested in projects that can look to address this. So essentially, we need to be clear, this is not just a grant. So it's a plan to bring together best practices, support, expertise, connections, and people to co-produce projects that you think will best support the folks from the underserved groups that we've been talking about, and also about us learning, all of us learning from the projects and from you. So I put some information together here on a slide. Let's see if I can manage this. Presenting Teams. Here we go. Okay, so it's very small for me. Let's see if I can make it a bit bigger. Okay, so yeah. So we're talking about here, essentially, we're talking about the fund, and we're talking about funding and advice to help you explore new ways to make volunteering more inclusive, and specifically for people who work with the groups that we've been talking about. The idea is that these projects will support people to engage in volunteering or to become volunteering ready. So that's the whole aim. We're looking to support projects that work with people from those groups who don't currently volunteer in the main. We're looking at projects that will help people become volunteering ready or to volunteer, and that will be a new development for the organisation. And you can see at the bottom here, we're talking about awards are for short-term projects up to 6 months, and the fund is up to £7,500. So if you're a constituted organisation, you've got up-to-date policies, and you work with the people that we've been discussing, then you fit that criteria. And in order to apply, we've got an expression of interest form on the website, which we'll send you a link to. Laura and Hannah will kindly send you a link to after we've talked this afternoon. And if it sounds like something that fits, then we'll work with you to develop that project before it goes forward to a panel of experts. As Nikki said, we haven't got the dates finalised, but we're estimating that we'll be ready for the first panel in June. And we'll have panels between June and January 27. And there's some details of how you can get in touch with me here. But again, that will be in the email that comes out. And then what I did was I put together this little flow chart. If it helps you, it's definitely helped me understand the process of how we think we're going to move this forward. So the idea is you'll bring, if you're interested, if it's something you're interested in, then we'd really encourage you to put forward your expression of interest. Yeah, everything that we've already spoken about. I'm not going to read through it in detail, but everything we've already spoken about. But there's some detail in the expression of interest form. That will come through to me, and I'll work with you to help kind of develop and refine that plan, and make sure that you fit the criteria for the national picture. And then what we'll do is we'll work with Community Action Norfolk or Suffolk and some local experts to help that proposal become a bit more robust, to make sure that everyone, so it really embodies that concept of co-production. And once we all feel comfortable with it, that's going to go forward to an award panel. So if that's unsuccessful, we'll get some feedback as to why that's unsuccessful, and we'll be able to kind of go back to the beginning if it's relevant. Or if for some reason it's not relevant, then maybe we need to change the plan. If we're successful, then we kind of move forward to more advice and support, predominantly, so we're moving up to point 6 here, from Community Action Norfolk or Community Action Suffolk, depending on whereabouts in Norfolk and Waveney you are. Now, Rick from Community Action Norfolk isn't able to be here today. I know Julie's here, but so he asked me just to talk a little bit about the kind of support that could be given at that stage. Yeah, so he talked about, in addition to administering the funds and offering the pre-panel expertise that we talked about earlier, they'll work with you on community development support, the kind of community development support they're really well known for. So that's things like helping you search for future funding opportunities for moving your project forward, looking at governance and potential legal issues, connections with other organisations, and some specific targeted support for you, depending on what your need is, to make the project and your organisation to really help with your success. So that will be part of the delivery of the project, and then there's going to be lots of this story sharing, because we want to learn. We need to learn. That's part of the project, and from the national picture. The national picture want to learn too. So this is where we really need to hear the stories, what's working, what isn't working, what the barriers are, what's felt really successful. And then we'll come to the end of that, and there'll be the evaluation is a really important part. So we've now got the expression of interest forms up on the website live, thanks to everyone working away furiously this morning. And there's a bit more detailed information up on the website also. I'm starting to talk with some key organisations with expertise in the field, whether that's looked after children or autistic folk or people who are neurodivergent. Yeah, so it depends, depending on who's. I'm starting to talk to those people in the field to help work with you on your expressions of interests and to turn those into project plans that you feel comfortable with. And yeah, like I said, we hope to have the first panel ready for June. I think that covers most of what I think is useful to share with you at this stage. Yeah, was there anything else you think you want to add into that?
No, I see that Mark's just put a question in about the expression of interest form. So we have put in some prompts in there for the sorts of things that you would perhaps need to think about during your first stage of planning. But we did also want it to be quite flexible. So it's not an application form where what you've said, that's it, it's set in stone. It can be your early thoughts. You could even put in there, we think this is important, but we need to get around this problem. But it's asking you to think about what the different aspects are, what are the difference that it will make to this project, to your the participants and to organizations, which other organizations you might be working with in terms of perhaps healthcare settings or host bodies. So there are prompts there to enable you to think about how can we make this work as effectively as possible. And then when you're happy with it, send it over and Katy will be having those conversations with you. So we'd much rather get in some only semi-worked up ideas in the next few weeks than you sit on it for 4 months trying to make it perfect. Because we have only actually got now 2 years of delivery, and that time passes really quickly. So we're keen to start seeing how it might look, and the things we haven't thought about, to be honest, and how we address those.
Yeah. So if you've got any questions, then feel free to pop them in the chat or take yourself off mute.
Should we take this down now?
Yeah.
So yeah, if you have any questions, just perhaps raise your hand. Yeah. And let's see. That's still there. Can you still see the presentation? Oh, lovely. Jade. So Jade, I should say has very recently joined us as our new chair of our programme board. So Jade, over to you.
Yeah, thank you, everyone. Yeah, this is really exciting, and I sort of echo what Mark has said in the chat. It's really exciting opportunity for us for Norfolk and Waveney. So, I'm really pleased to be asked to be the chair of the programme. I guess it was helpful to understand the timelines, I suppose, more for that. I mean, obviously you've gone through the process, which is brilliant, and everyone can see that through the slides. So thank you for that. But just about timelines, just to make sure we're meeting everyone's expectations and we're getting a really engaged process to make sure that all the sectors are being represented, so we can put in the best possible bid for Norfolk and Waveney.
Right, shall I answer that? So we're going to have a rolling programme of applications. So we are thinking that because CATA is going to be very much working on a one-to-one basis with organisations, we won't be able to cope with 40 organisations putting in applications, good applications that we can't manage. So we thought we would leave fairly short initial time opportunity window for this first round, see how those go. But there will be other rounds later in the year, probably roughly like 3 a year. This year, because we're starting partway through the year, but there'll probably one in October, November, and then one in early next year, and rolling round at sort of 3 to 4 month intervals, roughly, I would say, so that we can learn from one round, see how it goes, and perhaps make any adjustments. And also, if an organisation does run a very successful project, then it's possible for them to come back to a future round and say, we'd like to develop it in this way. We've tried it with that cohort. Maybe we can try it with this cohort or in a different area, or a slightly tweak the process because we've learned this from it. So that's why we're doing it in this way. So it's trying to be responsive, but have some sort of structure so that people know that we will publish the deadlines a little way down the line.
So a question here from Blythe. Any particular areas of volunteering that are preferred?
Not particularly. Obviously, this does to a certain extent have a health and care focus. So the long term is to encourage people into health and care situations, settings. But it might be that the first iteration of volunteering for someone who's never volunteered before might be in a more informal setting, might be in a community centre or in a with a cultural group or something like that, so that there's a sort of understanding of what's involved in volunteering before perhaps a bigger commitment to somewhere that is slightly more formal, where the expectations might be a bit different. So I'd say that nowhere's ruled out. But we do need to keep the bigger context in our minds.
Yeah, we'd very much like to hear your thoughts and ideas about that.
Right.
Okay.
Oh dear. Yes. Sorry. So Max is saying she's got the double voice echo. I hope not many of you got that. I don't know why. We've only got the one laptop in here. Usually it happens if there's too many laptops. Okay, well, okay. If there are no more questions, obviously you can contact us outside this meeting. You have CATA's email address. You can come back with any queries that occur to you afterwards, unless. Oh, Jo's just put her hand up.
Yes, thank you ever so much for that. Very interesting. How are you going to be able to achieve the connectivity that you've talked about? We have a project that we've been trying to develop for quite some time, because we've got some land, we've got a small holding, and we wanted to get the community involved in perhaps gardening and farming, and have some of the local farmers act as mentors to support the young people within that demographic you've talked about, neurodiversity, autistic, and so on. But it's so it was I'm clearly delighted to hear about the funding, but it's really more to see how best we could work with others collectively so that we're not working in isolation. So we have a resource that we would like to put forward, and really get other people engaged in this sense of working as a community around, getting people with neurodiversity and so on, rather than labeling people, but, you know, people who may be isolated also and find it useful to get involved, and really, it's really saying, look, we've got a hand up. We have a resource that can be used for the wider good of the community. How best could we connect with others to support that development? Thanks. Thank you.
Well, thank you. Yes, that's an interesting question. And I would just say as a starter that at Voluntary Norfolk, we do have connections with a lot of organisations. We have over 400 organisations who are part of our Voluntary Norfolk network. So once we know where you are and the sort of the nature of your project, you know, we would probably be able to look and see which other organisations are around that might be interested in partnering in some way, and to start to make some links. But that's part of that process that you would do with Kata. She will be able to come back with, once she understands your outline, and we can see how we can help you to make those links. But I think it will come down to you and building those based on your interests and what's appropriate and who's around.
Yeah.
Thank you.
Stuart, hello.
Hello. I was just wondering whether there's, I sort of took some photos of your slides, but is there any sort of particular size of organisation? Are there any restrictions on turnover or anything like that? No, they could be large or small.
Yeah, we're just interested to hear your project ideas and to see if together we can make them work.
Okay, okay, great. Super.
I mean, but partly we didn't set that because we're really keen to work with small organisations, because I think they very often have that real understanding of their local situation and the local people that they connect with. We don't want to rule them out, but if they're large organisations too, that's fine.
Okay, and have you got any sort of particular sort of standard sort of evaluation? It might be too early days to say that at the moment. Have you got any sort of evaluation date you're going to be doing at the beginning, and you'll be delivering all that, will you?
We will, but yeah, that's still being sort of finalised, but there will be some baseline measurements probably, and there will be evaluation processes during it. And we're also keen to learn about new ways, innovative ways of gathering people's responses and assessments, because we know that forms and online surveys, you know, just don't work for a lot of people. So it's like, how can we do it better? And then once we've learned that, we can spread it as good practice more widely. And I think that's very much what this is about, is let's get down some really nitty-gritty stuff and really learn some really useful practical lessons. And then once we know them, we can share them around our organisations in Norfolk and Waveney, but also nationally. And we will learn from them, hopefully.
Super.
Sorry, go ahead.
No, I was just saying super.
I'm not sure if everyone's able to see the chat. I know sometimes if you're coming in from your phone, it's quite tricky, but Jade has popped something in the chat, which I'll just read out, which is, we have a number of general practices who have expressed interest in getting more volunteers involved within their settings. So if any partners would be interested in exploring this as a pilot project, as a pilot concept, then please let me know. Dentistry is also very curious on this too. Thanks for that, Jade. Thank you.
Great.
Someone had their hand.
Yes, so Shelley Ames from the ICB has just joined a little while ago. So over to you, Shelley.
Thanks. Hi everyone. Sorry, I ducked out quickly. I had a delivery that I had to go and save, but I'm back. And I may have missed it, but I just wondered how we were defining innovation in terms of the Innovation Fund. So how I guess I wouldn't want people to be put off applying for a grant and thinking that actually we're asking for huge change for a relatively small pot of money. So I just wondered if you'd done any work yet to think about what do we mean by innovation, and in what areas might we be thinking in that? Is it in the delivery itself? Is it in how we promote? Could it be in all of those things? I was just curious about the sort of level of innovation you think might be needed.
Yeah, that's a really good question, actually. And I don't think we've defined it. We have said it needs to be new to the organisation, what, you know, the project they're putting forward to us. We don't just want a repeat of something that's already been delivered and just a repeat. But if it was something that they thought was quite developmental, and they tried it in one area and they now wanted to try it in a different area, then that for us, I think, would count as innovation. But as you say, it doesn't need to be earth-shattering. It's just trying to get away from this always works for us, so we're just going to carry on doing a bit more of it. I think it's looking at that. And I think you're right about communications. It's also looking at how do we get the word out, perhaps in different ways, because that's something we really need to be aware of with volunteering. You know, the actual language around volunteering is sometimes off-putting. So I think there are lots of different ways that we can explore that, but we don't have any hard and fast rules at the moment. Other questions? Okay. Well, thank you so much for those questions, those comments. Really, really useful. And as I say, you can always come back to us afterwards. So we'd now just like to move on. And the third sort of strand of the project is around supporting training and development. And so we have, well, this is the sneak preview of Get Involved Skills, because no one's seen it until now. So I'm going to hand over to Laura and Hannah, who have been working hard in the background for the last few months to get this ready to share, but it is still a work in progress. But over to them.
Hello everyone, I'm just going to get my screen up if I can share. Okay, so yes, we're going to give you a quick overview of the new platform, Get Involved Skills. So hopefully lots of you will already be familiar with Get Involved Norfolk, which is our volunteer recruitment platform. Get Involved Skills is designed in the same way, focuses specifically on training and development opportunities. So the goal of the site is to make it easier for both volunteers and those working in organisations that involve volunteers to find and access relevant training. So this will be both for volunteers looking to build their skills before starting a role, and for those already working or volunteering who want to develop their practice further. It's user-friendly and includes features to track and record or complete. One of the key benefits is that all available training will be brought together in one central place. This will save time and make it easier to find the right opportunities without having to go on lots of different websites. In addition to the listings for the training, the site will also host a range of resources to support those who manage and work with volunteers, as well as practical guidance and tools which is specifically for volunteers themselves. So me and Laura have been working as part of the development. So we've been contacting local and national organisations to feature training on the site. So the platform is currently being populated with a range of these training opportunities. There's not that many on there at the moment, but we've got lots to come, so it'll be growing all the time. We'd also love to hear from you if your organisation offers training, because we're all about sharing. So if you'd like to see your training included, we'd love to hear from you. We'll include the details of how to get in touch in the email that we send out after the event. So I'm just going to hand over to Laura now, who will give you a little run through of some of the features of the site.
Thank you. So hello everybody, what we've landed on now is the main landing page of Get Involved Skills. It is a live site, so do feel free to go back later and have another look. So the main feature of the site, as Hannah has mentioned, are training. So we've got training tabs along the top, which have, I think it's not showing that, is it? Look, that's not ideal.
Do you want to stop sharing and share again?
I'm going to stop sharing and share again because what I'm doing on my screen is not showing on the other screen. So we're going to give it a bash to try something different. Let's try another way.
I think screen, how to share screen.
Open, get involved. Sharing, isn't it? If I can share it on this one. Yeah, try it. I'm going to try another way. Okay. Does that one come up? Yeah. Fabulous. We're going to try it another way because this is our IT is not playing ball today. So as we said, the main features of the site are training. So you can see the training tab is one of the first ones along, and we've got separated it into training for volunteers and for organisations, as well as e-learning modules. So I'll give you a brief look at the training for organisations pages. So you'll see we're going to have it in sections of sort of health and safety and social, IT and digital, and so on for each sort of cause and topic. So that'll be for the organisations page. As Hannah mentioned, we've also got resources. So we've got resources again for volunteers, resources for volunteer managers, and also resources kindly shared with us via from the ICB. So the resources page is fully populated already, but we'll add as we find more topics to put on there. But there's anything from training and supporting volunteers, DBS and what that involves, and retaining volunteers. So there's lots and lots of resources on there now. And like I said, we'll add more on there as well. So I know a few of you mentioned earlier about the Innovation Fund that Kata was talking about. That page is all live on Get Involved Skills. You'll find it under the Volunteering for Health tab. And then we've got about the Volunteering for Health project and the Get Involved Innovation Fund. So on that page, you'll find everything that Kata mentioned in her presentation earlier, as well as the expression of interest form. So do go and have a look at that. And do get in touch if you have any questions at all. So like Hannah said, the page is populated at the moment. We are adding more things on as the time sort of progresses. We're also keen to hear from you if you've got any training that you'd like to share. So do get in touch with us if there's anything that you'd like for us to pop onto the platform. We're really keen to get organisations from Norfolk and Waveney involved in the process of sharing your training and sort of providing that support to other organisations as well. Has anybody got any questions about the Get Involved Skills platform at all? No. Pop the links shortly and everything will be sent out to you by email as well. So like I said, do have a look at the platform, have a look at the Volunteering for Health tabs, and do check back regularly as well, because we're adding training daily. That's all from me.
Thank you, Laura and Hannah. That was brilliant. Once the IT behaved itself. I'm sorry, some of you have struggled, I think, with sound today. We a few people have either had a bit of an echo or it's been a bit juddery, I think. Anyway, I hope enough of you heard enough to give you a flavour of what it's about, that your main questions have been answered. And that you know where to come for more information, and feel confident that you can find out what you need or contact one of us to do so. So just to say again that the Get Involved Skills platform is at an early stage. There's not as much content on there as we would like, but it's the sort of nature of the project that it is, as I said, sort of evolving. And for the time being, if we are going to be adding any additional training from our end, but in due course, in a couple of months' time, it will be functioning very similarly to Get Involved Norfolk, where once you've registered, you will be able to upload your own training that you be willing to share. So that will be very easy for you to do. But that facility isn't available just yet, but we will have a more in-depth session about the skills platform and be able to report back on how it's being used, and any comments that we've had about what would be useful and is missing, or any changes. So please do see this as an interactive process, and anything that you feel that you'd like to have more information about, or you feel is missing, or you would like to contribute to, we're always here. We're really, really keen to hear from you, and we want to keep learning about how we can do things better. Good. So thank you for all your comments in the chat and your questions. Final chance for anybody, pop up a hand. Oh, thank you, Joe. And Helen, thank you for your comments. Yeah, so no further questions. There you are. You've got 16 minutes of your life back. So I hope that was useful, and I look forward to seeing you in real life at some point. Thank you so much for coming.